I'm going to focus on human rights and issues of governance around the response from many governments across Africa. And so as we've heard, through as the spread of the virus reached Africa months behind other regions, perhaps should have given African countries the opportunity to prepare. But as Dr. John said, a lot was done to make sure that was in place, but a number of issues and existing challenges made the response difficult. However, the many governments, at least 45 sub-Saharan African countries, have invoked emergency powers to enforce mandatory quarantines and isolation, restriction of movement, and social distancing to slow down the spread of the virus. Now we have looked at the situation, especially around the government response, using a framework of 5 intersectional areas to monitor the application of emergency powers and implementation of some of these measures. The first area that we have looked at is access to information and technology. Here we're focused on how governments are ensuring that people have information they need about the virus, including through the internet. In Ethiopia, for example, we warned very early on at the onset of the spread of the disease in Africa that the then 3-month-long government shutdown of the internet in Western Oromia, where an insurgency operation is ongoing, violated multiple rights and could have deadly consequences for the health of the people there. The government has since restored telecom services in the region, but this is an issue that we're monitoring very closely across Africa. We have seen attempts to use emergency powers to curtail media freedom in Somalia and in Rwanda, where several journalists have been arrested, beaten, and detained for criticizing government response and for reporting on complaints. We have also highlighted how misinformation, especially by government officials, can undermine efforts to limit the spread of the virus. We've done this in Tanzania, and of course, as Gervais just presented in Burundi, where the government has refused to acknowledge the threat that the disease presents with claims of national exceptionalism. The government also PNG'd, declared persona non grata and expelled the WHO country representative and 3 of its experts. However, health workers in Bujumbura have told us that they are concerned that the tests are not being carried out. And then on the other hand, they are continuing to record an increase in the number of deaths and suspected cases coming into the hospitals. They are worried that the government's messaging around the virus will mean that people would not seek treatment and that many more could die. The second area we're monitoring is in the application of containment measures for people in custody. This includes people in prisons, detention centers, and closed institutions such as for older people, people with disabilities, and survivors of gendered violence. We're also seeing an increase in cases of women stuck in violent domestic situations, unable to get help because of the restrictions of movement. Now, in terms of prisons, with up to 70% of inmates in prisons across Africa in pretrial detention, most of the prisons across the continent are overcrowded. Of course, this makes social distancing and self-isolation virtually impossible. For example, in Cameroon, which has one of the worst prison population densities in Africa, we have advocated for release of pretrial detainees, particularly non-violent offenders like political prisoners and people who are at the latter end of serving out their sentences. We're very gratified to see that beginning from April 15, the government of Cameroon began to release some of these categories of detainees to curb the disease's spread, and has so far released over 300 people. Similar releases are also being implemented in the Democratic Republic of Congo, in Rwanda, Uganda, and South Africa. The third area that we focus on is on migration. For this, we're looking at asylum seekers, migrants, refugees, internally displaced people. In conflict situations such as we have in South Sudan, in Northeast Nigeria and the Sahel, we have raised concerns about the challenges of providing adequate health and sanitation services, including clean water, and of course, the practice of social distancing in these large and overcrowded refugee camps, as well as informal settlements for internally displaced people and formal camps. We've raised concerns that many migrants and asylum seekers, for example, in South Africa, are being excluded in the provision of some of the palliative economic measures, including food aid and other services. Many of these asylum seekers and migrants are lesbian, gay, bisexual, and transgender people who have fled to South Africa to escape persecution in their home countries. As you may know, 33 out of the 70 countries around the world that criminalize adult consensual same-sex conduct are in Africa. And so many look to South Africa as a place of refuge. We have called on the authorities to address this challenge for this category of people. We're also documenting incidents of COVID-19 related discrimination and hate crimes, frequently targeting Asian migrants in some African countries, as well as on the other side of the world, discriminatory and xenophobic treatment of Africans in some parts of China. The fourth area we're focusing on is on poverty and inequality. Our concern is that the lockdowns are especially punishing for low-income earners and people in informal sectors who already live in the economic margins, mostly in large urban slums and informal settlements across most cities in Africa. In South Africa, we recorded that security forces used rubber bullets and water cannons to disperse homeless people who are lining up for food, telling them to go home when they had no home to go to. Ugandan and Kenyan authorities have forcefully quarantined travelers at airports, and and also people who are alleged to have flouted curfews have been, punitively asked to either pay for a mandatory 14 days self-isolation in government-designated hotels at amounts that are excessive for most Ugandans and Kenyans, or for them to stay in unsanitary and ill-equipped isolation centers, thus, compounding the problems and the capacity of those centers with people who have no business being there. Some countries, including Nigeria, Rwanda, and South Africa, have introduced some social and economic safety nets to mitigate the negative effects of these measures, but they have faced huge challenges in ensuring that they are equitable and efficient, as I've mentioned in the example of LGBT people and migrants in South Africa. The recognition of this, some of those tough measures are that the measures are harming not just the poor, but the country's economies. The governments are rolling back some of these measures, including in Nigeria, Kenya, DRC, Ghana, in phases. But we can come to a bit more on that when we get to the question and answer. Finally, my final point is on the abusive enforcement of these measures. Security forces deployed, especially in countries with historically abusive forces, have been implicated in the use of excessive force to enforce stay-at-home and social distancing orders. And in some cases, they have used these measures as a ploy for repression of political opposition and LGBT people. For example, Ugandan forces detained for more than 50 days and accused 19 young people of flouting social distancing rules because they lived in a homeless shelter, having been rejected by their families for being LGBT. Fortunately, we wrote to the prosecutor in Uganda to drop these baseless charges, and she did just that. She dropped the charges and the youths were released. But we have also reported on the excessive use of force by police in Kenya, for example, killing a 13-year-old boy in front of his own house, beating and tear gassing crowds of people on their way home from work for allegedly violating the curfew. We've documented similar reports of shooting and killing of people perceived of flouting restrictions in Rwanda, South Africa, and Nigeria. In Nigeria, the National Human Rights Commission, not even an international organization like ours, reported that beginning from the early days of the lockdown, security forces enforcing restrictions had killed more people than the disease itself had killed. And so we are, as the African Commission on Human and People's Rights has done as well, urging governments to make human rights central in their responses, including by ensuring equitable access to healthcare, protecting the most vulnerable groups, and refraining from the excessive use of force in the enforcement of measures or otherwise abusing emergency powers, including by using it as a pretext for targeting critics, journalists, opposition politicians, as well as marginalized groups like migrants and LGBT. I will stop there. I know I'm over time, but thank you.